people feeling better, looking better, living as long as they can, as healthy as they can. Colin, I run the Exercise Oncology Residency Center here in Pittsburgh, part of Allegheny Health Network. A radiation oncologist, I'm in charge of breast cancer here as well. So I spend part of my time treating patients in the clinic, and then I spend a little bit more of my time here in the exercise center, training a lot of those same patients. We run a lot of studies here. We really look at exercise as a treatment. He was a huge influence. So he grew up a block away from me, so he helped raise me. And health was just his number one. He was taking vitamins, he lifted weights and exercised till he was almost 90, was very active his entire life. So every part of his life was just active, and he was very well thought out. He would source different foods from different areas where they had the highest nutrients, minerals, and vitamins. So from a young age, that was basically imprint on my life. And as I became a physician, I realized just how important his message was, right? Not just treating disease, but preventing it. I like dealing with patients, I like interacting with patients, I like the science and techie side of it as well. And at least when I train, not so much anymore, but during radiation treatment, it could be anywhere from 5, 6 weeks long. You meet with patients day in and day out during that treatment. So it was a pretty cool experience to spend that much time with people. What was interesting is during my training, one of my mentors did research on calorie restriction, and another one of my mentors did research on the ketogenic diet. And during that time, I realized those same tenets that my grandfather taught me as a kid were coming back full circle, that healthy nutrition, exercise, resistance training, building muscle mass, all those things can actually reduce your risk of getting cancer. If you have cancer, it can increase your chance of cure from cancer, and it can actually offset some of the side effects. I mean, I've always been a huge proponent of exercise and nutrition. From the medical side, it's been disjointed, and now recent years there's such a big push to basically marry them all. So it's really fortuitous for me that it all came full circle. Initially, it was a bit disjointed. So I would see, we'll talk about breast cancer, I would see women in consultation. I would treat them, and we'll say if they had an early stage breast cancer, DCIS, they would get a lumpectomy, then they'd come see me and we do radiation afterwards. And a lot of times we would help cure them, help reduce the risk of the cancer coming back locally, but we weren't doing anything for other issues they were having. So metabolic syndrome, obesity, they're strongly correlated with breast cancer. So we were curing the breast cancer, but we weren't curing or resolving one of the issues that correlated strongly with the breast cancer. So my mentors, we started writing papers, looking at exercise, looking at nutrition, looking at activity levels. It wasn't as well received as I would have expected initially. Now a huge part of medicine is opening their eyes to it. A recent study came out showing an improvement in survival, a presentation at the European Society of Medical Oncology, survival in women that exercised. And not just any kind of exercise, it was intense resistance training. So the types of things we do to build muscle, to improve body composition. Now in terms of overloading them, there's huge concerns in the beginning. So we ran a series of dose escalation studies. Basically what we found is we just keep pushing individuals harder. The injury rates are incredibly low. Things like lymphedema, we have a study coming out showing improved lymphedema after the exercise regimen. So that was something that people were very concerned about, loading these women, having them overhead pressing, etc. I mean, we do it unilaterally and we do it safely. But every study we keep doing, we keep pushing them harder and harder. We're getting better results, and we keep realizing that we're not at the threshold. If you have movement issues, and that could be from your surgery, etc., or if you have really bad movement issues, like you can't even get up and down off the ground, we have you push and pull sled. Pushing a sled is extremely intense. If you can walk and carry groceries, you can push a sled. We have ways to increase the intensity while keeping it safe. And what we're seeing now is that the results are so good that we feel as if we're not doing that to someone, we're shortchanging them. If you know what you're doing and you have a skilled staff, we have a great staff of exercise physiologists, you can progressively overload people to see gains in the first 3 months after their surgery. So we have women that are cleared after a mastectomy, after full axillary dissection, or more so after lumpectomy and sentinel lymph node. As soon as the surgeon clears them, we're overloading them. We're progressively overloading them. And what we're seeing is huge muscle mass gains in the first 3 months, even right after surgery. Well, the good is that, we see a lot of individuals that weren't working out, they're deconditioned from their surgery, from chemo. We have a bunch of people in here now that just finished treatment for head and neck cancer, which is brutal. You get radiation, so you have trouble swallowing. so you just lose tons of weight. We have them coming in here, they are putting on an insane amount of muscle mass because of they lost so much. So some of it's regression to the mean, but we're seeing them put on 6+ pounds of muscle 3 months after finishing head and neck radiation. Those have been profound changes. The other, in our studies where we allow women undergoing neoadjuvant chemo before surgery, so they're getting adriamycin, they're getting ACT, kind of these heavy hitter chemos that initially we didn't even allow women on those chemos to exercise. And then a couple said, too bad, we want to come on, study and do it. So we changed the enrollment criteria to allow them, and we've been seeing insane changes in them. We're talking 1 or 2 pounds of muscle mass gain and 1 or 2 pounds of fat mass lost, but that's while getting some of the most toxic chemotherapy you can imagine. So those changes are profound. Those are the ones you remember, and even a lot of the docs in the system, some of the medical oncologists and surgeons, they've been coming and working out with their patients, and they've been saying the same, that it's crazy. They're seeing these patients on adriamycin working out harder than they're working out, and they're worried about them coming into the surgery so that they'll be in the best shape of their lives while on chemo. Those have been some amazing findings. The negative ones are when individuals come into the gym, push it as hard as they possibly can, but they don't change their diet, and their diet is not a good one. So then what we'll see is we'll gain muscle mass, but then they'll also gain fat mass, because when they're working out, they're hungrier afterwards, but they haven't changed. So those are the unfortunate, and then those are the ones where we put them through the InBody and they say, well, what happened? And we have to have a hard conversation at that point. Right, the numbers don't lie. And that's why it's great, because if you're pushing it hard, though for some of those we'll say, look at the muscle mass changes. If you just improved your nutrition, you would be off the chart. And a lot of those individuals do, they get it then. What I found in my whole career, and there's a reason why I'm so heavy on the exercise, is if you get people in here and get them addicted to the exercise, nutrition will follow. If you lead with the nutrition component, it is much more difficult because most people fall off the wagon. Right? If you fall off the wagon nutrition-wise, but you're in here working out with us day in and day out, it's a lot easier to get back on. And that's kind of it's not a secret. That's how we get people through here, and that's why we're here, 2.5 years later, seeing people with insane changes over time. 60 pounds of fat loss. We just passed a woman out there, that's what she's lost in the last 1.5 years. So you just see these remarkable changes. Especially individuals, on one hand we're talking about, are we concerned about their lymphedema and range of motion? And those are individuals you don't send home, right? They need to exercise in front of us. And so I'm in there half the time with them. I'm a certified strength and conditioning specialist. Our exercise physiologists are all CSCSs as well. That's who we have training, coaching, and treating them. I think exercise is generally better in the gym. And that goes for me too. The days where I'll work out at lunch, or I'll say, I'm going to work out after work at home. It doesn't happen, or it happens at maybe 50%, right? We all struggle with that. So getting everyone in here in a group of like-minded individuals, they yell at each other, they motivate each other, we talk smack. It's a really good environment, and it does really improve motivation. We have sit-down sessions every other week on Fridays, and we sit down in the back corner, we call it the pit, and we all just sit there and talk. People that come to those generally have good compliance because they get reminded. On the study, some people had amazing changes, and then there was a 15 to 20% of people are not as compliant as they should be. The issue is not just saying eat this diet or follow this eating pattern. It's you have to change your whole way of life and how you view things, right? And that's the whole quality perspective. If your health is one of the most important things in your life, then you're not going to eat those foods every day, right? It's all just part of this larger picture where you just want to do your best and be your best. So when you get people thinking that way, it makes it a lot easier. If it's just this game of changing your diet to lose this weight, I mean, it's a short-term game, and it's, I like the infinite games as they've been called, yeah. The biggest issue is everyone looks at the scale, and we have to keep telling them to stop looking at the scale. We have people that go through this program where based on the scale, the results would be a disaster. Then they do the InBody and see that they actually gained muscle mass and lost fat mass. They just gained a heck of a lot of muscle mass, which is a lot harder to do. So those changes are actually the best we're going to see. In every study we've done, none of them care about weight. Not a single one do we look at weight or do we look at BMI. We look at muscle mass and we look at fat mass, and we look at percent muscle mass and percent body fat, right? Those are the two most important metrics. And if you look at the newer data coming out, particularly in the breast cancer world, that's what it's showing. It's showing more muscle mass, longer survival, less fat mass, longer survival. So those are the only metrics we care about. And it is really cool and motivating for individuals to see their muscle mass going up, especially when you track it over the long haul, because in 1 to 3 months, you're not going to gain that much muscle mass. Some people do, most people don't, especially people that are trained. If you're well trained, you're not going to come in here and throw in 5 pounds of muscle. But when you follow those lines over the long term and see the fat dropping and the muscle mass going up, I mean, that's the reward at the end of the day, and it's long term. That's super motivating. And then just getting people to that point where they're eating right, they're exercising, they're seeing the changes, they're sleeping well. It turns to not this game of how do I make these changes, but it's the opposite, where if you don't do those things, you just don't feel good, right? You don't sleep as well, and at that point, once that happens, then you're hooked, and it's a lifelong. If you look at our first 3 studies, we track a bunch of different things. Obviously, we track all the metrics on the InBody, we track Y balance, functional movement screen. Obviously, we track lymphedema, quality of life. So after 3 months, the majority of women gain a significant amount of muscle mass in their upper extremities, and they lose a significant amount of fat mass. In our last study, looking at both exercise and nutrition, you saw significant recomp of the upper extremities. So again, more muscle mass, less fat mass. So of course that's going to be better from a lymphedema point of view. The only modifiable risk factor for lymphedema after your surgery is obesity, right? It correlates strongly with the number of lymph nodes removed, which you can't change, or obesity. So if you have less adipose tissue in the way of the flow patterns, more muscle mass, and you're using that muscle mass to exercise, i.e. pumping that fluid out, as long as you do it safely and don't injure yourself, it's the perfect recipe to reduce the risk of lymphedema. Our PTs and OTs use 3% contralateral versus the ipsilateral arm and that difference, and that'll trigger potential lymphedema. That's a low. Some places use 10%. And so at that point, we increase surveillance, have them do activities, maybe do a sleeve if they need to. However, the issue is if they're here exercising and there's hypertrophy and they're losing fat, and it's not happening symmetrically, because it rarely does happen symmetrically, what do those measurements mean then, right? That's where the InBody comes in, right? We can look at the fluid dynamics and say, oh, they're actually improving, or we should be concerned, these numbers have gone up. So we use it for everything, and I think kind of the standard here. Phase angle, of course, the fluidity of your cells, and there are pretty good studies showing that correlates with outcomes, especially in the cancer world, that correlates with outcomes. So we always look at that. Actually, every study that we've done, the phase angle has significantly improved. That's another thing where you may look better and you may feel better, but here's a marker saying your cells are actually healthier, right? And we talked about the bone mineral concentration on there, and these things that are signaling that it's not just you changing on the outside, it's you changing on the inside. So we dig deeper with that. We look at the population averages of central adipose tissue on there, so we look at that as well. Metabolic rate, we find it interesting, especially because there's so much data showing that correlates with fat-free mass. So again, as you're putting on more muscle mass, you're going to improve your metabolism. We don't look at it from a calorie counting point of view, but we do show it to people to say, hey, instead of counting calories or going out for a run to think you're going to burn the food you ate, you're building muscle mass, so you're burning that 24 hours a day. We look at the visceral fat. We have the setting where it has the population curves on there. So if you look at the data, too much fat is bad. Too much visceral fat is very bad. So of course we look at that. I want people feeling better, looking better, living as long as they can, as healthy as they can. I want them like my grandfather, right? Lifting weights in the basement at age 88. So we do re-intakes at 3 months. So they go through everything we mentioned, the FMS, the Y balance, the InBody, etc. Having them see those changes and know that they did that themselves, right? It wasn't my radiation or the medical oncologist, or Arimidex or chemo or the CERT. You did that all yourself, right? And the number of times people do the outtakes and they're in tears is, I could every week, right? So it's the best job in the world, right? It's not a job. It's amazing. I could do it. I could do it till, hopefully, like my grandfather, I'm 96. But seeing people make those changes and then seeing them realize they could do that, the empowerment that you give people. We have a sign out front that says not empowering, not pandering. We tell people where they need to improve. Sometimes it's a bitter pill to swallow, and then you see them do it, and you see them just coming in here crushing it day in and day out, and then you see a 65-year-old breast cancer patient who had a bilateral mastectomy in the best shape of her life at that point, it's insane. It's the most empowering thing in the world. And then, we just had a rowing event. We had a 5K, and you see them there, and they're just in incredible shape, looking great, feeling great. I mean, it's the best feeling in the world.